Hello, and welcome to the Interpreting the Results video, which is part 5 in the tutorial video series about the 2022 Health Center Patient Survey Dashboard from the Health Resources and Services Administration, or HRSA. The Health Center Patient Survey, or HCPS, collects data on patients who receive services at health centers funded under Section 330 of the Public Health Service Act. The 2022 HCPS dashboard allows users to analyze survey data, tailor the results by survey question and population filter, and download the results to both CSV and PNG formats. Please visit the 2022 HCPS landing page for more information on the survey. This video will cover how to understand the dashboard results, such as how the results are calculated, the purpose of suppressed results, why some questions are not asked of all populations, and how best to use the chart options to display the most applicable results for your needs. First, let's review the results after selecting a primary question and a comparison question. The results displayed in the dashboard are calculated from a random sample of the full health center patient population. For the 2022 dataset, the random sample included about 4,400 people out of about 29 million in the full patient population. Because the dashboard results are based on a sample, they are estimates of the true values. Each estimate has some amount of uncertainty associated with it. This uncertainty is sometimes called the margin of error and is represented in the dashboard as a confidence interval. The confidence intervals can be turned on or off depending on your needs. They display as a blue bar on the chart or as a separate column on the table. Estimates with a wide confidence interval have more uncertainty than estimates with a narrow confidence interval. Roughly speaking, the 95% confidence interval is the range where you can expect to find the true value with about 95% confidence. For some estimates, the uncertainty is so large that they may be unreliable, and you're strongly advised not to use such estimates to draw any conclusions. In fact, the dashboard hides these estimates from you. This is known as suppression. In this example, the results for Hispanic never have been replaced by an asterisk, which indicates the results have been suppressed or hidden. Some questions are not asked of all survey participants because not all questions apply to all patients. For example, participants under age 50 skipped past questions about colonoscopies, and participants who have never had diabetes skipped past questions about managing diabetes. Results displayed in the dashboard apply only to the subset of patients who did not skip past the specific question. To show an example, let's change the primary question to be, in the past 12 months, have you been in the hospital or visited an emergency room because of diabetes? And remove the comparison question. The chart shows the results for the primary question of, in the past 12 months, have you been in the hospital or visited an emergency room because of diabetes? The dashboard shows that about 9% of the patients would say yes. But this is 9% of the patients who have had diabetes in the past 3 years, not 9% of all patients. The percentage of all patients would be much lower. Making this distinction is very important when interpreting the results. For this question, patients who have had diabetes in the past 3 years is known as the applicable population. The dashboard displays the applicable population in two places, In the question details, when choosing a question, and in the footnotes below the chart or table. The footnote regarding applicable population only displays for questions that apply to a specific subset of the population. It does not display for questions that apply to the full health center population. Now let's review the chart options using a different example. The primary question will now be age. And the comparison question will be, in the last 12 months, did you or a doctor or other health professional believe you needed any medical care, tests, or treatment? When the results are in chart format, you can toggle between percentage and population size. Depending on the context of your research interest, sometimes you may want to know the percentage of patients who meet some condition, and other times you may want to know the actual number of patients. In this example, when the chart unit is set to percentage, 77% of the 65 to 74 age group needed medical care in the past year. Nearly identical to the 45 to 64 age group. When the chart unit is set to population size, the results show that only about 2 million 65 to 74-year-olds needed medical care, compared to about 5.5 million 45 to 64-year-olds. The chart and table results can easily be downloaded using the download options. Click Chart to download the chart to an image file in PNG format. Click Table to download the table to a CSV file, which you can open in a spreadsheet application like Excel. The results include a notes section below the chart or table that includes additional information about the results. The first note describes suppressed results, which was discussed earlier in this video. This note only displays if data in the results are suppressed. The second note describes the meaning of the text in brackets, which indicate abbreviated names for the survey questions. These correspond to variable names from the survey's public use file in case you want to refer to that file. These can be seen below the title of the chart, in the headers of the columns, and in the question details when selecting a question. The third note identifies the source of the data. It also provides some statistical details about how the calculations are performed and about estimates being representative of the health center patient population. The last note is a recommendation to not compare 2014 and 2022 HCPS data. The data cannot be easily compared between the 2 years because the data collection methods changed with the COVID-19 pandemic. The results will clear out if you change the data year, and you will need to select new values. This concludes the Interpreting the Results video for HRSA's Health Center Patient Survey Dashboard. For more information on using this dashboard, please refer to the About This Dashboard PDF. For more detailed information on getting started with the dashboard, selecting a primary question, selecting a comparison question, or applying a population filter, please watch the other videos in this tutorial series. For more information about the 2022 Health Center Patient Survey, visit the HCPS landing page on data.hrsa.gov. Thank you for watching.